All right, let's get right into it. There's a massive global economic shift happening right now, and it might just trigger a gold rush in one of India's most important sectors. We're talking about healthcare, and this is an opportunity that has really been decades in the making. But here's the interesting thing. To really understand this story, we're not going to start in a hospital or a lab. Nope, we're starting right here, with what could be a huge crisis for the auto industry. And it's all because one country has a near monopoly on a resource that is absolutely essential for building almost anything modern. Just look at that number, 90%. Let that sink in for a second. That is how much of the world's processing capacity for rare earth magnets is controlled by China. And these aren't just simple little magnets. They're critical components in everything from your electric car to a fighter jet. Right now, one country is holding pretty much all the cards. So you can see why this isn't just about magnets anymore. This is about a dangerous over-reliance on a single source for so many critical goods. And that realization? It has sent a shockwave through boardrooms and government halls all over the world. The risk of keeping all your manufacturing eggs in one basket, it's just become too big to ignore. And that's forcing a scramble for a brand new strategy. And this global scramble, it actually has a name. It's called the China Plus One strategy. And believe me, it is way more than just a buzzword. It represents one of the biggest realignments of global supply chains in our lifetime. So what is it, really? Well, at its core, it's just a common-sense plan to reduce risk. Companies are no longer comfortable being so dependent on China, so they're actively looking for new partners, new factories, new markets. The idea isn't to leave China entirely, but to add a plus one, another country to the mix. And finding that plus one has kicked off this massive global opportunity. And that, right there, brings us to the heart of our story. Because while a lot of countries are fighting to become that plus one, there's one specific sector in one specific country that is uniquely positioned to capitalize on this whole shift. We are talking about Indian healthcare's big moment. You see, the Indian healthcare ecosystem is really built on these 5 powerful pillars. You've got everything from the hospitals treating patients to the labs diagnosing them, all the way to the companies that are actually making the medicines. And each one of these has its own compelling growth story, which creates a really diversified opportunity. Now, to really wrap our heads around the potential here, it helps to think a little differently. So let's break down these different healthcare businesses using some really simple, powerful analogies from other industries, ones you probably know even better. Okay, first up, hospitals. I want you to think of a big hospital chain less like a single medical building and more like a high-end retail chain. Seriously. The business model is all about strategic expansion, opening new locations in the right places, and making sure each one performs well. It's just like a retail brand that's tapping into a growing middle class with more money to spend. So, what about diagnostic labs? Well, their business model actually looks a whole lot like a fast food chain. It's all about scale, efficiency, and just blanketing the market. You open new, standardized collection centers in as many places as you can to make affordable tests accessible to millions of people. And branded generic medicines? Oh, this one's easy. They operate just like your favorite consumer goods. Things you buy at the grocery store. When you're sick, you don't just ask for any medicine. You ask for a brand you know and trust, right? So success here is all about building that brand loyalty through smart marketing, a massive distribution network, and having the power to set your prices. But those analogies, they're really just the warm-up act. The biggest, most direct China Plus One story is right here. It's in the fundamental building blocks of medicine itself. Active pharmaceutical ingredients, or APIs. This is where the scale of this opportunity becomes truly, truly staggering. Just look at these numbers. They're pretty stark. Right now, China exports around $30 billion worth of APIs every year. India? Just $4 billion. That massive $26 billion gap, well, that represents a colossal opportunity for growth. And here is the most powerful part of this whole story. For India to win big, it doesn't need to capture all of China's business, or even half of it. Think about this. Just a modest 10% shift in global sourcing away from China would be enough to double the size of the entire Indian API industry. That is a total game changer. And this isn't just some market trend that's happening on its own. Oh no. The Indian government sees this opportunity loud and clear, and it's stepping in to basically pour fuel on the fire. turning this whole thing into a national strategic priority. As part of the national budget, the government announced this major new initiative called Biopharma Shakti, and its goal is crystal clear: to boost domestic manufacturing of advanced medicines, to make the nation's supply chain more secure, and to reduce its reliance on imports from other countries. And they are putting some serious money where their mouth is. This scheme has an initial budget of 10,000 crore rupees over the next 5 years. This isn't just policy talk, it's a huge financial commitment to supercharge the sector's growth. So what we're really seeing here is a kind of perfect storm. On one hand, you've got this powerful global trend, China plus one, forcing companies to look for alternatives. Then you have India's private sector, with all those pillars we talked about ready and waiting to meet that demand. And finally, you have strong government support, creating the absolute ideal conditions for growth. When you see all these forces converging, the global trends, the private sector's readiness, and the public sector's support, it really leaves us with one big question to chew on. With all of these pieces falling perfectly into place, is India finally on the verge of claiming the title of the world's pharmacy? The opportunity? Well, it's never been clearer.